You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Voices from the Frontline is a new podcast series dedicated to spotlighting the unique experiences and insights of the dedicated, passionate people at the helm of APCHO's member health organizations. In this episode, APCHO's Membership Relations Associate, Grace Sonia Milano, speaks with Teresita Batayola, CEO of International Community Health Services, ICHS, about the power of community collaboration and strategic momentum building when it came to galvanizing statewide support for healthcare reform.
Hello, Teresita. I'd like to begin by asking you about the Healthcare for All rally you participated in during the month of May in downtown Seattle. The event received quite a bit of press coverage, but I'd like to hear your perspective about the day and how you worked with other community groups to bring more than 3,000 people together.
Well, it was very exciting. I mean, when you were facing that big of a crowd, basically, we had to do a lot to charge people to get them interested and excited in the healthcare reform. In our state, there's a group called Healthy Washington Coalition, which is over 100 different community-based, professional-based, labor group-based, just across the spectrum of people who are very interested and very concerned about healthcare reform. In our state alone, because of the economy, by the end of this year, there will be close to 900,000 people who are uninsured. But even before the economy started to sour, there were already a lot of people who were either having a problem in terms of finding the right kind of coverage, if they could afford coverage or if they had an employer who could provide coverage, or who had the potential of facing medical bankruptcies. And healthcare costs kept spiraling up. So there was a buildup of concern already in our state. In fact, prior to President Obama getting elected, in our state there was already a movement that's been brewing to try and do healthcare reform in our state. Our governor, the state insurance commissioner, the state legislature were already talking about different ways about establishing performance-based, evidence-based kind of reward or reimbursement systems, if you will. So that conversation was already happening. So once healthcare reform started to crystallize at the federal level, this loose connection of people that became the Healthy Washington Coalition basically realized, hey, working with the state is great, but we need to take it to the federal level because the federal level can, affect the changes in a much broader, bigger, faster way than the state alone. And so we were already fortunate to have had that Healthy Washington Coalition. So, in fact, even before this big rally, there was already a series of town halls all over the state. And the very first town hall, I was fortunate enough to be one of the speakers to help kick it off. And we had started, to attract a whole lot of people. So our first town hall generated about a couple of hundred people, and then as it moved around the state, it started to attract more. So by the time we did the rally, there was already the word out and interest, and people were concerned. And at that time, now the times have changed, but at that time, it was still an issue of we got to get everybody's attention, that it's not just an interest of the president, that it is an interest for every single one of us who needs some kind of health coverage in our or access to health care in our lives or for ourselves or our families, that every single one of us needed to care. So now, of course, the times have changed. We're doing the same thing again in terms of organizing, because there are many anti-reform groups that have started to generate too much interest and buzz, and we do not want healthcare reform to be stalled. So we are, elevating our and accelerating our voices and involvement again. So we did our march in May, but now we need to do it again into the fall until healthcare reform is passed.
My next question to you is, what is the role that community health centers play in healthcare reform, and why do you think health centers care so much about this issue?
Community health centers have served as the healthcare home or medical home for what I would consider to be more challenging populations in our entire history of existence. And community health centers have been around for over 35 years. You know, our part of our history is having started as free clinics for those who've never had health care or have had difficulty getting access to health care. And over the years, community health centers have gotten more robust so that we provide medical, dental, pharmaceutical, health education, behavioral services, just the full range of services that I would challenge that a lot of other healthcare providers don't offer that full range of services. So basically, community health centers tend to focus on our populations, what they need, and serve them much more than what their particular health care need is at that time, at the time that we're seeing them for a visit. So we truly are a healthcare home. I believe that as part of healthcare reform, if we're talking about improving the health status of Americans, that the current system that we have right now that's disconnected, where you might have a primary doctor and then you've got a bunch of specialists who could be either part of a practice or different practices, or where basically you're not in partnership with your doctor. And I'm saying this as a broad statement, that if we're truly serious about improving the health status of Americans, that it needs to be more of a system. It needs to be more of a partnership between the healthcare provider and the individual, and hopefully with the community, because part of everyone's health also has to do with their environment, with their living conditions, with their ability to interact in a productive, social, positive settings. So that's the kind of thing that community health centers provide. And I truly believe that community health centers are part of the solution, not just for the low-income population, the marginalized population, those who cannot access quality care, but that we are a good model for everyone else. So, and when you take a look at our statistics, not only are we effective, not only do we provide quality care, but that we really are able to provide quality care at an affordable level for the consumer, and that when you take a look at our performance, the cost effectiveness is there. So I believe we need to be part of the healthcare reform discussion as part of the solution, but also to make sure that the populations that nobody else wanted to see today and in the past will continue to be seen and cared for and nurtured by someone. And we have that track record.
Thank you. So before we conclude, I would like to ask you if you have any final thoughts that you would like to share with our podcast listening audience.
If it's aired in September time period, Congress will be back. Congress will start working again on this. And if they're not working again on healthcare reform, bombard them with phone calls and emails and visits to make sure they are working on healthcare reform. Let's all make sure that something happens this year, because we cannot afford to go another year without some kind of healthcare reform, whether it starts with a health insurance reform or not. We need something to happen here.
Thanks for listening to AAPCHO's Voices from the Front Line, conversations illuminating our vision of equitable, affordable, and culturally appropriate healthcare for all. Please join the conversation on our Facebook fan page at www.facebook.com/AAPCHO.